My name is Julie Pope. I'm doing my persuasive speech for Columbus State University for communication. This is Sheena. She's doing the recording.
Hi.
This is Travis. She's a nurse at the hospital.
Hi.
And this is Estelita.
Hi.
And my persuasive speech is on Affordable Health Care Act improves patient health. A chronic illness is a condition or disease whose course of disease is greater than 3 months. Arthritis, asthma, cancer, COPD, diabetes, hepatitis C, and HIV/AIDS are a few examples of common chronic diseases, and that's from Chronic Condition 2015. In a report by the Robert Wood Johnson Foundation, February 2013, it states that the U.S. healthcare system suffers from a chronic malignity, the revolving door syndrome, at its hospitals. It is so bad that the federal government says 1 in 5 elderly patients will be back in the hospital within 30 days of leaving. In the Affordable Health Care Act improves patient health, the purpose is to inform our audience of the importance of the need for health care reform in order to improve quality of patient care, health, and overall well-being. And this image is from J.W. Walker and boxwordpress.com. And who am I to talk about that? I'm a registered nurse of the largest hospitals in Central Georgia. The majority of our patients are Medicare recipients with chronic illnesses that are frequently hospitalized for the same medical diagnosis. And that image is from JPN training program. Healthcare reform is necessary in order to improve the quality of patient care, health, and overall well-being. First, let's discuss how healthcare reform is necessary in order to improve the quality of patient care in the hospital. CMS implemented the Hospital Value-Based Purchasing Program, which ties the patient to the payment to the value. Payments are linked to clinical processes of care and patients' experience of care. This means that the hospitals that perform at certain quality measures receive higher payments. Hospitals with low performance will receive decreased payments, and that's from the U.S. Department of Health and Human Services, November 2011. And as you can see in this chart, in New Jersey, there was a 250-bed hospital that was considered a good hospital by Joint Commission, but because they did not meet standards, they were penalized a maximum of 1% in the fiscal year 2013, which resulted in a loss for their profits for $446,000. Secondly, healthcare reform is necessary in order to improve patient health by utilizing preventive care exams. Under the Affordable Care Act, preventative services will be covered through private health plans without imposing cost sharing, such as co-payments, deductibles, or co-insurance. Some examples of these services are well women and men visits, screenings for diabetes, depression, cholesterol, HIV, STIs, and colon cancer. And that's from the Henry J. Kaiser Family Foundation, October 28, 2014. And as you can see here, hospital care in the U.S. costs patients around $814 billion, which is 31.4% of the revenue. Physician and clinical services is about $516 billion. Other personal health care and other health spending, which is your preventive care and everything, totals up to $408 billion and $384 billion. Lastly, healthcare reform is necessary in order to improve the overall well-being of patients by allowing individuals more access to health care. Young adults can be covered on their parents' insurance until age 26 under this plan. Lifetime limits on what insurance will cover have been outlawed. The cost of many drugs for seniors on Medicare have been lowered. Free preventative care for patients of all ages has been expanded, and that's from Consumer Reports, March 2013. In conclusion, 1 in 5 elderly patients are readmitted to the hospital for chronic illnesses within the first 30 days after discharge from the hospital. This is known as the revolving door syndrome. To summarize briefly what was discussed, healthcare reform is necessary because it improves the quality of patient care received in the hospital, improves patient health by utilizing preventive care exams, and improves overall well-being of patients by allowing individuals more access to health care. Initiatives in healthcare Medicare reform are implemented to decrease the 30-day hospital readmission rate by improving care coordination and integration, which in turn will ensure better health care and improve patient outcomes in the healthcare delivery system. That's the Commonwealth Fund 2013. And these are my references.